We're creating a tool the same way that a medical equipment manufacturer provides an MRI. The building is a tool. At the end of the day, the healthcare is not the building, it's the people inside.
You're listening to Smart Thinking, a podcast from WSP. I'm Matthew Marston, taking you on a journey into smart buildings. In this episode, we're talking about smart healthcare. And joining me on live link from Dallas is Nolan Romay, and from Toronto, Kevin Cassidy. Nolan Romay is the co-chair of our global healthcare leadership team with 19 years of experience in healthcare. Nolan was principal on 50% of the lead platinum hospitals around the world. In Toronto, Kevin Cassidy is WSP's Canada healthcare lead with 18 years of experience in healthcare. Kevin specialises in public and private market shares. Welcome to both, and Nolan, we'll kick off with you. What is a smart hospital?
Smart hospital for me is facilities where we're taking a multidisciplinary approach to let clinicians spend more time being clinicians, interfacing with their patients, and the patients interacting with their environment in a way they have control to heal and be more well and be more comfortable.
Kevin, what's your take on that?
I tend to agree with Nolan. What I'd add on top of that is a truly smart hospital isn't just the building systems that are involved with it and the control. It's also taking regular clinical jobs that those clinicians would be doing and finding a way that the building can actually automate those to free up that time that Nolan was speaking about.
I will say that in the UK, we seem to be struggling in bridging the gap between the digital services that the hospital operates on with some of the building automation. Are you seeing more traction in North America?
We see a larger demand on the operational side. I think because Kevin and I both work on a fair amount of private hospitals, it's the majority of our market share, especially in the US. They're looking at how you predict those operational outcomes, and that's what drives bridging that gap between the digitalization side and, say, the facility, all the way down to the facility operator. I think it's finding a way to make those interfaces effective and a way to make those interfaces more stream of consciousness so that the staff doesn't have to think as much. It's more automated to get to all the systems and collect all the data and then find a way that's useful.
And Kevin, what is the public hospital perspective?
Absolutely. There's certainly a drive towards it. A lot of the new hospitals that we're seeing get built here in Canada, there's a strong desire to implement more of that automation. If you talk to the executives at some of these buildings, they realize that using automation and getting those processes in place are actually going to increase the outcomes of their patients. They're going to minimize drug errors, and it's happening. Automated pharmacies are certainly here tracking the products that they deliver through the facility to make sure that the right patient gets the right drugs, absolutely here. The challenge that we definitely find is how hospitals actually procure these systems and these services. So as you can imagine, publicly funded system, we have to make sure that everything is fair and procured in a fair manner. This is cutting edge technology that not a lot of people do, and every hospital is doing it in a different way. So it's taking some time for the market to adjust to really figure out how we build these systems in place, because quite often it's a customized solution. It's not something you can just flip through a catalog and buy.
Kevin, I just want to ask you a little bit further about that. How do you see smart technology improving the patient experience?
Well, there's two very different things. There's patient experience, and then there's patient outcomes. So, improving the patient outcomes, which I suppose is part of the experience. If you can track things, if you can measure things, and you have the data, you can then learn from your mistakes and make the next experience or the next treatment for a patient be that much better. So hopefully over time, you're learning from the data that the building's able to collect for you so that you can improve the care you're giving. On the patient experience side, it's absolutely limitless in terms of how we can improve that with technology. A really good example in a pediatric hospital, a child that's in for leukemia treatment could be spending months in that hospital. Can we leverage technologies if they're from a rural part of the country with a small, close-knit group of friends, and they now need to come to a large urban center where they don't know anybody? It can be very overwhelming because there could very well be more people in that hospital than there are in the town that they're from. Can we leverage that technology so they can still attend classes remotely? Can they still have that communication? It can be quite isolating when you're away from your home and you've only got one or two family members that have traveled with you. So, leveraging technologies in that way to improve the experience and try to normalize as much as possible what someone's going through and keep those connections, I think can be tremendously uplifting to someone that's in the hospital for a long period of time.
Oh, for sure. And that sounds incredibly exciting.
I think that can flip the other way too, Kevin. I think as 5G technology and other things, the data catches up with the demand, a lot of those people can start to stay home more. Telemedicine actually becomes more of a real opportunity for people to be diagnosed and for people to have conversations with their medical staff without leaving the farm and without leaving the rural environments that they're traveling great distances from that lead to anxiety and lead to things that are, say, the antagonist to wellness.
Nolan, what challenges are you seeing from your clients?
We're seeing a great deal of challenge around the complexity of our facilities. We're taking a lot of systems and bringing them to, let's say, a singular backbone and putting clinical private networks on top of public accessible networks for patients and for staff and for visitors. And the human side of that, the people that have to maintain those systems over time, you're also not just bridging those systems into each other, but you're bridging all the people that support those systems and having them coordinate and have them communicate in a way that is completely supportive of the end users. So you've got to be able to support and maintain those systems, let's say to create less infection risk. We are promoting better systems integration so that we can maintain our air handlers better. We can maintain and schedule operating rooms better in a way that the doctors think about it less, the charting nurses think about it less, and it allows them to focus more on the task at hand, which is delivering care and delivering very intense, complex procedures to our patients. Those people that can receive the training to maintain those systems, but also giving them a new skill set to actually coordinate and integrate and communicate with other people in a way that's totally behind the scenes and supportive.
Why would somebody want to work with a consulting engineer for systems integration to deliver some of the outcomes that you've mentioned?
We gave a tour to Kaiser Permanente at our innovation center here in Boulder, Colorado, and it really struck us with a simple question that Kaiser posed, which is why would vendors want to work with engineering firms and design firms on integration? And they can't sell you anything. Our very simple response back was, that's right, we don't sell anything. So we can test things, we can break it, we can help look for outcomes because we're doing what's best for the community and what's best for our clients. And that doesn't, that's pretty much independent of the brand name that comes on it. Because of that, there are some times where that's a challenge and we can't sign some of the agreements that people want us to sign for research. But I think that's a healthy conversation, a healthy push in the community, that it's getting a little less commodity-based and getting a little less sales-based and starting to really drive some outcomes.
Yeah, it's interesting, right? Like the number one, from an ethical perspective, the number one duty of an engineer is to protect the public. And I can't think of a better way to do that than to be involved in healthcare design or healthcare projects. So, it might sound a bit altruistic, but it's an altruistic type of thing. And I think you're right, Nolan, being able to do that and work on behalf of our clients to really test things out and see what works and what doesn't and provide that unbiased advice is really, really important.
No, I agree. And healthcare for me, and the reason I've been doing this for 20 years is it keeps driving to be more community-based. It starts with a smart building and starts with a smart campus. And that bleeds into a greater discussion about what is wellness for a community, what is the outreach, the education, the making people's day-to-day lives more well and making their lives smarter, letting them know more about themselves and how to care for themselves. That's where the solution really happens.
It sounds like the future of healthcare is more than just a building, and we've got a little bit of work to do. One quick question I had for both of you, and Kevin, if you could go first. If somebody wanted to make a smart building, what would your 2 top tips be?
That term smart building, when you actually start to talk to people, it means completely different things to every single person you're going to talk to. And I think the most important thing to do is from the get-go, start to communicate and actually have that dialogue around what people actually want. What do they want the building to do? If it is a quote-unquote smart tool, let's find out how you want it to function, why you want it to function, what are the goals you're actually trying to achieve, and use that as the basis to then set up what you're going to specify technically to make that building work. The number two thing I think you want to talk about right from the get-go is security, confidentiality, and how you're going to deal with sensitive information that you need to make that building work. Because it's all fine and good to say that you've got an end goal that you want to achieve, but if that involves tracking where things and people are in the building, have you had that discussion with the people that you're going to track to make sure you understand the privacy concerns? If you need access to patient data, have you had the conversation around how you're going to secure that patient data so that you can use it in a safe and secure way that isn't going to compromise the individual's private information? Quite often we found that the goals that you set at the beginning can get derailed later on because no one's thought about how that information is going to be accessed or how we're going to hold on to it, and haven't had those discussions. So I suppose overriding both of those things, which is maybe number three, is communication, and start talking about it right from the beginning.
And Nolan, do you have any top tips to add?
Yeah, I think I totally agree with both of Kevin's points, and to that third point, I would engage your user base. I think when you're talking about smart buildings and particularly smart hospitals, you need to reach out to your client base and the people that are going to be served and benefit from that. Aside from just the clinical users, I think that's one of the great things that the NHS does in the UK is it's a requirement of their projects to really have a user champion group that's involved with their large projects. I was on a design committee with Great Ormond Street Hospital. The child advocates, children advocates were actually some of the strongest and smartest voices in the room.
A big thank you to Nolan Romay in Dallas and Kevin Cassidy in Toronto.
That was fun. That was a lot of fun.
In our next episode, we'll be talking about how you can increase productivity from a smart building with Steve Jarvis from Cordless Consultants. If something in this episode has piqued your interest, then have a chat with us. Email smart@wsp.com. You've been listening to Smart Thinking, a podcast from WSP. I'm Matthew Marson, and thanks for listening.